Hello and good morning, everyone. It's a beautiful Thursday po, and our topic today is very interesting. Actually, wala pa akong nakita talagang lay forum po dito. Our topic po is the intensive care unit o yung tinatawag po nating ICU. Ano po ang nangyayari doon? Sino po ang na-ICU? Bakit sila na-ICU? Paano makalabas na ICU ng buhay? And lastly, bakit ba napakamahal na ICU? At ano ba 'tong ICU na 'to? Okay. So, let's put our title lang po as ICU or Intensive Care Unit para maikli lang po. Let's put our title again, Intensive Care Unit. Masyado po mahaba yung question eh. So, good morning. I'm Dr. Ana York Bondoc. Ayan, our title, Intensive Care Unit. Our title reflects my specialty. I am Dr. Ana York Bondoc po. I am a pulmonary specialist and an intensive care specialist. So ICU ho talaga yung aking specialty. And this is actually my first time to talk about my topic, which is actually what I studied for and trained for. Kasi most of us po, parang pulmo ang gustong pag-usapan. But dahil po sumikat din po ang ICU nitong COVID, let's learn more about this special unit and scary unit. Sana hindi ho maging masyadong scary after this talk in the hospital. So tara na po, ICU na tayo. So,
Nasabi niyo
our
po
first
ba?
question. Sige, thanks Miss Kat. Ay, for those asking where is my nurse, Miss Reina, I have good news for you. Si Miss Reina po ay nagpa-second dose ng AstraZeneca today. So siguro po, after a few days, we'll hear from her kung ano po yung nangyaring side effects sa kanya. Sana wala na po. Okay? So Miss Kat is here to help us. So sige, Miss Kat, let's start. Nag-guide questions lang po ako para maintindihan po natin yung proseso.
Okay po. So our first question po is, ano ang ICU?
Okay. Maraming nakakarinig po nitong term na ICU, lalo na po ngayong panahon ng COVID, no? Because a lot of COVID patients have passed away. And marami po sa ating nakakarinig na ICU na po si Lola ni ganon, na ICU na po si ganito. And shortly after that, they either get better or yung iba po, sadly, at nakikiramay, nagpa-pass away. So ICU is short for Intensive Care Unit. Okay? Intensive Care Unit. This is a place po sa bawat ospital. Well, most of the bigger hospitals, the smaller hospitals do not have ICUs po. At ano ba ginagawa sa ICU at sinong napupunta doon? This is a place, it's a place for specialized care po or what we call critical care. And usually po, ang nalalagay po sa ICU are those people with severe illness, okay? Acute severe illness. Yung biglaan nangyayari, grabe po yung pangyayari, and we need to save the patient's life. What's in the ICU? Ayan, acute severe illness. Okay. What's in the ICU po? A lot of things are in the ICU. There are going to be specialized doctors and nurses. So yung care po doon at talagang one-on-one. Sa normal ward po, a nurse has more than 5 patients. In the ICU, there will be close monitoring and care. There will be specialized equipments po na pag-uusapan po natin as we go along that are only available in the ICU. Of course, with the specialized equipment and care, we can use mga sensitive drugs. Pag-uusapan din po what are the sensitive drugs, And hopefully, with a combination of drugs, equipments, procedures, at saka po personnel and close monitoring, masasalba po natin yung buhay ng ating pasyente. Okay? Marami bang klaseng ICU? Yes, there are many ICUs. So, normally po, kaming mga doktor, we classify it into 2 kinds. One is the medical ICU and the other one po is the surgical ICU. Okay. Ako po, I'm a specialist in both medical and surgical ICU. Even though I am not a surgeon and most surgeons are also specializing in surgical, there are most of the people who do surgical ICU are indeed surgeons. Ako po, I was trained in surgical ICU. So what's medical versus surgical ICU? Okay. Yung puntahan muna natin si surgical kasi yun po yung naiiba. Okay? Si surgical ICU po, those are the ICUs po ng mga taong naoperahan. Okay? Mga taong naoperahan. Okay. And they usually undergo a life-saving surgery or a big surgery, yung matagal, komplikado. So they normally have to recover. They cannot just leave the anesthesia. Kasi after surgery, you go to the anesthesia care, gigisingin po kayo. And then after that, you either go to your regular room or kung talaga pong malaki yung surgery, you cannot wake up that quickly, you lost a lot of blood, then you need to go to the surgical ICU. Okay? So, sinong nasa surgical ICU? Number one po, trauma patients. Okay, what is trauma patient? Nasagasaan, nabundol, sinaksak, binaril. Okay? Lalo na po sa sensitibong parte ng katawan like our heart, nasagasaan, multiple bali, ganun po. Trauma, okay? These kinds of patients are usually operated on to save their lives and usually, lalo na po kung sa sensitibong parte po ng katawan, they need to go back. They cannot go to the room kaagad. Maraming nawalan dugo, nabaril sa puso, sinaksak ang baga, ganun po. They need to recover in a surgical ICU. These patients, lalo na ho kung bata pa, malakas pa, and mabilis pong nadala sa ospital, they were able to cover the blood loss at hindi po masyadong grabe yung nangyari, these people usually recover quickly and can get out of the surgical ICU. Those who also go to the surgical ICU, aside from trauma patients, cardiac surgery, kung kayo po ay na-bypass, neurosurgery, and sometimes large cancer surgery. So yun po yung nalalagay sa surgical ICU. So puntahan po natin ngayon ang medical ICU. Who goes to the medical ICU? Okay? Normally, people who go to the medical ICU are those po with acute infections. Pwede pong pulmonya or any, most common talaga po is pulmonya. Okay? And that might include the COVID patient, kaya COVID pneumonia. So yun po yung napupunta sa medical ICU. Okay? Of course, those po, number one talaga is infection eh. Yun po talaga ang pinadadala po natin to the medical ICU. Are there specialized ICUs? Yes. Yung mga inatake po sa puso, sometimes they have a cardiac ICU. Pero they can also stay naman po in the medical ICU, lalo na kung mas maliit po yung ospital. Not all hospitals have a cardiac ICU. So kung inatake po kayo sa puso, you may be staying in either a cardiac ICU or a medical ICU. Kung kayo po ay na-stroke na grabe, again, there is a neuro ICU for big hospitals. Sa mga regular hospital, medical ICU, okay na rin po yon. So those are usually, kung dinugo po kayo sa tiyan, GI bleeding, poisoning, infections, heart attack, pulmonary embolism, matinding asthma, COVID, ICU po yon. Okay? There are specialized ICUs in the hospital. I think I mentioned this. If you're a child, meron pong pediatric ICU. If you're a baby, like yung mga yung mga kulang sa buwan, there is the neonatal ICU. Kung buntis po kayo, ayan, pediatric ICU for the kids. Meron pa hong for the little preemies, neonatal. And sa mga buntis, meron pong maternal ICU. So yun po yon. But in general, it is okay na po to separate into surgical and medical. Malaking bagay na po yan. Ang maternal, sa mga nahirapang magbuntis, ano? And for the smaller hospitals, kung minsan napapagsama pa rin po yung surgical and medical. But as a rule, we like to separate surgical from medical. Kasi po, yung surgical, for example, nasagasaan ka, no? Or binaril ka, wala ka namang pulmonya eh. So they try to separate, sometimes we call it clean versus dirty. Kasi po, yung and I don't mean the dirty, medical term lang po yon. But kasi po, we try to separate those from with a lot of infection from those po na biglaan. Kasi po, I will go into that later. There is a huge component of hospital-acquired pneumonia. As in sa ICU ka pa, nagka-pulmonya. And that can be very bad. Okay, next po. So ano bang nangyayari sa ICU? Like if somebody tells you, okay, we have to bring your lola or your lolo to the ICU. First of all, the person is seriously ill. Okay? Um, sa US at sa mga ospital po ng gobyerno, we have very strict criteria kung sino pong dapat i-ICU. Okay? Unfortunately, sa Pilipinas, with the private hospital, sometimes kahit sino na lang ina-ICU, lalo na kung makabayad. And hindi ko po linalahat but that is not a good practice. May strict criteria po talaga for who should get into the ICU and not. Kasi, an ICU can have good points and an ICU can have bad points. So, papasukin po natin yan. So, what's happening in the ICU? First of all, close monitoring. Ano? You usually go to the ICU kasi may bumigay pong parte ng katawan nyo. And when I mean parte, I mean system. Either you had a heart attack, so your heart is na tinamaan. If you have pneumonia and you can no longer breathe on your own, then matutubo po kayo, ang bumigay po sa inyo yung inyong baga. If you are losing blood pressure po, then again, your vascular system is not working. Kung bigla pong bumigay yung kidneys nyo, you need acute dialysis, then your kidneys po ang bumigay. So, there is close monitoring po with the various organ systems na tinamaan. Okay? By illness. So, close monitoring, sino po, it's a team approach. There is an ICU doctor. There are ICU nurses. Meron pa rin hong mga ICU pharmacists. So, dapat po talaga team. Hindi lang po kaya na isa, pero marami pong mga tutulong sa inyo. Aside from that, what's happening po in the ICU? Ano po? Aside from that, we will do a number of things depending po on what organ system ang bumigay or what organ system po ang tinamaan. For example, as I mentioned before, if you have pneumonia, sabihin na po natin COVID pneumonia, you will be likely intubated po and a machine will help you breathe. Okay? So that is the process po of intubation. Okay? That is to support your that is to support your lungs. Ano po? If you need, as I mentioned, bumababa blood pressure, you will need medications po to bring up your blood pressure. So, yun po yung mga procedures. If you need dialysis, dialysis. So, magsasama-sama po lahat yon in an ICU depending on your needs. Okay? So, next po, I think I mentioned, parang we forgot letter B. Sino po ang nasa ICU? Ano po? Balikan lang po natin si letter B. Guys, don't forget naka-letter yan, okay? Sino po yung ICU? These are usually po patients who have been advised by their doctors po na they have a severe acute illness and they need to enter the intensive care unit. So these are patients who are seriously ill. As I mentioned po, pwedeng na heart attack, pwedeng na stroke, pwedeng na pulmonya, pwede pong trauma, pwede pong children who got seriously ill or moms. Okay? Let's move to letter D, the good points of the ICU. Okay? What are the good points? Bakit po linalagay sa ICU ang isang pasyente? Okay, number 1 po, linalagay po sa ICU ang isang pasyente dahil serious po sila, may sakit. Once they are in the ICU, ano bang advantage ni ICU versus the ward? Okay, number 1 yung monitoring po na sinabi ko. In the ward, the nurse has at least 5 patients. Meron pa nga hong mas marami pa and that's really not a good thing. In the ICU po, 2:1. 2 nurses, 2 patients to 1 nurse. Meron pa ho kung talagang may sakit po kayo, 1:1, talaga pong nakabantay po sa inyo ang inyong nurse. And this is a really big advantage. Kasi po sa ICU, there will be drugs po na ilalagay po natin that would require minute by minute monitoring. Meron pong mga ganon. These are drips that will increase your blood pressure and iba pa po, no? Usually, number 1, blood pressure drugs po talaga ang minomonitor. In the ICU, we usually put the medicines po by suero. Kasi po yun ang pinakamabilis and direct way. So, IV na po yung antibiotics nyo o sa suero. IV na rin po yung insulina nyo. IV rin po yung sedation nyo. IV na rin po yung mga gamot nyo sa puso. Because why do we give most of the drugs po by suero? Kasi po, usually patients are so sick they can no longer swallow or pati yung tiyan nila apektado. So, yun po yun, ano, there are drugs and procedures that will happen in the ICU that need talagang, kuminsan even, we take our hourly or even less hourly monitoring. In the wards po, they take the blood pressure, the heart rate, every 8 hours. Sa ICU po talaga, every hour. At meron pa hong mga times na nakaupo na po talaga yung nurse nyo sa tabi nyo at talagang tinititigan po kayo. Because napakadelikado po ng inyong sitwasyon that we have to act quickly and accordingly. So yun po talaga yung main reason why we bring patients to the ICU. Again, there is the expert care kasi marami po talaga may eksperto doon who will be looking at you. Not to say na sa ward walang expert, pero hindi naman ho sila doon minuminuto unlike sa ICU. Okay? There are procedures that are safer done po in the ICU, like they can do bedside dialysis, they can do bedside procedures, they can raise your blood pressure. Meron tinawag pong pain control and sedation. Kuminsan po talagang napakasakit ng pangyayari, the patient nagwawala. So pinatutulog po, it's like a form of anesthesia na rin po happening. And again, that again requires constant and close monitoring. Meron din pong situations na life support na talaga ang binibigay sa inyo. That usually happens in a cardiac ICU. Again, the monitoring needs to be not even only hourly, kuminsan talagang tutok na tutok po yung nurse sa inyo. Okay? So what are the bad points naman po of ICU? So yun ang good points. Being in the ICU can enable you to receive complicated procedures with close monitoring. But again, it's not perfect kasi may mga bad points din po yung ICU. And what are the bad points? Number one po talaga sa akin, yung separation from the family. It being an ICU, hindi po pwede yung barangay ng pamilya nyo nandun. Okay? Talagang ano po, once you stay in the ICU, the relatives have to stay outside. Sometimes they allow persons to come in kasi most of the time tulog naman yung tao. Pero ako po, no, being a doctor for a long time, malaki sa akin po, and especially kung alam kong hindi naman magiging maganda yung outcome po sa ICU, malaki po sa akin yung presence of family. Kasi not all patients will survive the ICU. And it really pains me po na merong naghihirap na hindi po nila kasama yung kanila po mga loved ones. So that's really very difficult. Sa akin, the emotional effects of separating the patient from their family is a big deal. Okay? Number two, very important also, yung infection rate po, no? The infection rate po in an ICU is very high. What do I mean by that? Doktora, di ba may pulmonya yung pasyente pag pumasok, o may UTI o may ano na infection. Bakit sinabi mo na may infection pa? You mean they got sick in the hospital? Yes, I'm sorry to tell you po talaga that pneumonia is actually classified into two forms. Yung community-acquired pneumonia, yung nagkasakit po kayo sa bahay nyo. And sad to inform everyone, there is what we call po the hospital-acquired pneumonia. The hospital, hindi po malinis na lugar yan. So, wag po kayong magpa-hospital or magpa-ICU until it is truly necessary. Okay? Because these germs, they are, ano po usually resistant to drugs kasi po, maraming binibigay po na antibiotics sa loob na ICU. Nasasanay po yung mga bugs or infections sa drugs and they become super bugs. Okay? And ang hirap po talagang tanggalin sa ICU. They are in the air, they are in the equipments, they are everywhere. Okay, hindi lang COVID ang everywhere. Hospital-acquired pneumonia is notorious and deadly. Okay? So, if you do not need to go to the ICU, please don't go kasi usually, no, bakit nga ba nangyayari yung hospital-acquired pneumonia? Aside from the germs being everywhere, yung mga tao po nakatubo, okay? That tubo is a direct connection into their lungs. So, madali lang pumasok doon yung mga pathogens, bugs, infections, viruses that are floating around the ICU. Ang bilis-bilis po, no? Pagdating nila doon, I'll give you a story, okay? For example, dumating po, inatake sa puso. Okay? So, nasave po yung life. Nandun sa ICU. Okay na po si puso. After a while, mga 3 to 4 days, biglang linalagnat na ho yung pasyente. Oh my gosh, sabi namin, wala namang pulmonya yung tao. That's why we x-ray you before you come in. What's going on? Bakit biglang ang dami-dami na hong Parang ang dami-dami na hong nasa suction, biglang ang dami, tapos biglang temperature, sumasama. Pag x-ray mo, pak, ayan na, hospital-acquired pneumonia. So, ang bilis po nun talaga. Okay? Another issue, marami po talagang na-UTI, sa dami po ng mga catheter na ginagamit, ang dami pong na-infection from the suero, kasi ang daming suero. So, there are good points and there are kaakibat na bad points, which is number one talaga is infection dun sa ICU. So I mentioned infection, separated from family. And now that you're separated from your family, harapin na po natin. The ICU is a sad and scary place. Okay? True, it can save your life. But kung minsan po talagang kung may nervous kayo at gising kayo, nakakita nyo po, nagkakagulo dun sa kabilang kama, then namatay na ho yung kabilang kama, then dinabas. It's not really pleasant. I think I posted sad and scary po, no? And I saw it. Paki-ano lang. So, kung may nervous po kayo, it's not a good place. Kaya lang, let's focus on the positive that it can also, kung may namamatay, meron naman din pong nabubuhay. So let's focus po on the positive aspects po of the ICU. Pero I honestly tell you, hindi po madali sa pamilya, sa pasyente, to be separated from each other. Kasama lang po yung pasyente, yung nurse. And then, nakikita nyo po, syempre naman sensitive din tayo and kahit papano na, napapag-usapan ng mga nurse na wala na si bed 4. Oh my God, that's so horrible talaga. I hope na wala si bed 4 kasi bumalik na siya sa kanyang normal bed. But sometimes talaga, I mean, people pass away in the ICU. And let's be honest, it's not the best, okay? So, kung talagang hindi po kayo kailangan mag-ICU, don't go there, okay? Kasi merong mga tao talaga, and I would like to say this, may mga tao, Doc, nininervous ako, ICU niyo na si nanay. Yung nervous niyo po, listen to your doctor because I spoke about infections, I spoke about separation from family, I spoke about it being scary. It's true. So, i-weigh niyo po lahat yon. And if you need to go to the ICU, the doctor will tell you. If you don't need to go to the ICU, do not go. Okay? Number 4 po, sobrang gastos. Ito po, tapatan na lang po, no? People always ask, my God, na 1 million, na 2 million, ganon. Mahal ho talagang magpa-ICU. Because of the equipments, the specialized, the specialized doctors who are gonna be looking at you. Sa dami po ng nurses, 1:1, lahat po yon really adds up to a lot of gastos. In the US po, no? In the US and it's a government hospital po talaga. They will really tell you po na the situation, tapatan lang. In the US naman po, the hospital charging, kung matagal po sa ICU yung tao, nawawalan po ng pera yung ospital. Unfortunately, kasi it's insurance-based, dito po sa Pilipinas, unfortunately, habang tumatagal po yung tao sa ospital, lumalaki po ang kita ng ospital. And dun ho nagkakaroon ng problema. So, what you need po is an honest to goodness talk po with your doctor. And honest to goodness assessment po with your relatives. Okay, so next po, how to decide? The question is, does everyone deserve to be in the ICU? Ang hirap na tanong po yun eh. And this is what we call decision making or triaging. Triage. That's a medical term. Ito-type ko lang po. Ayan, triaging po. Okay? So, first of all, how to decide? The first thing that you need to think about is, ano ho ba ang nangyari dun sa pasyente? And that's a form of triage. Ano pong nangyari? Is it serious? Is it life-threatening? Does it require po na pumunta po kayo sa ICU? If the answer po is yes, then sasabihin naman po ng doktor that you need to go. Okay? The second po is the benefits. It's hard to, ano ba yung benefits? Makakatulong ba sa aking mother, lola, daddy kung pumunta po siya sa ICU? We think about the ICU as a positive place where you can receive a lot of treatments. Pero, let's be honest, it's also a place po na we can cause harm also. So, kailangan po pag-usapan yung mabuti ng inyong doktor, what happened? Ano po ang maitutulong ng ICU? And kailangan nyo rin pong pag-usapan kung ano po ang harm na pwede pong mangyari sa isang ICU. Meron din po. Okay? And the best thing to do is to be very honest with your doctor and to be very honest din po kung ano po ang expectation ng inyong pamilya. Let's go into that later kasi po I will talk about this is lahat po ba ng pumapasok sa ICU ay nabubuhay o namamatay? Magandang usapan yan later during the questions. I saw something. So you need to talk about the risks versus the benefits. Ano po ang matutulong ng ICU at may maitutulong po ba ang ICU? And hopefully, it's best to be honest with your doctor in this case of scenario. Okay? And lastly, nasa Pilipinas po tayo, kailangan po tayong mag-usap about gastos. Kailangan po maging honest and open din po kayo sa inyong doctor. Cost is a very big issue po sa Pilipinas. So in the end, what can I tell you? The ICU is a place po sa ospital called the intensive care unit where we treat patients who are very seriously ill. We try to give them the best and most modern medical care possible para po maisalba ang buhay nila. Pero there comes a time na hindi na rin po makakatulong ang ICU, and that is a time that you need to have an open and honest talk po with your doctor and with your family, respecting the wishes po ng inyong pasyente. Okay? So I think there are some questions. So magandang umaga po sa inyong lahat. I hope you learned a little more about the ICU. Okay? I think we have a few pictures. May pictures ba tayo?
Yes po, meron po. Share ko lang po.
Sige. Tara, share natin yung pictures. Let's talk about them. Marami ho sa inyong hindi pa nakapasok sa ICU, am I correct? In fact, nakakatakot po talaga. But once you understand what's going on, medyo konting explanation. Ito po yung ICU patient na typical. Letter A, pwede ba natin i-focus yung letter A? Ano ba si letter A? Parang tubo yan eh. Ayan. Do you see letter A? Ayan po. That's what we call, yan. That patient is intubated. Bakit po naka-intubate? Sa Pilipino po tinatawag na natubo eh. Naka-tape po yung mukha niya para hindi po gumalaw yung tubo. Yung tubo pong yan is leading straight to the lungs and that helps the patient breathe better. Ang meaning po kung bakit natubo, hindi na po kaya ng pasyente to breathe on their own and they need to have a machine take over po dun sa problema. We can have an entire talk on intubation later on. Yes, a lot of COVID patients po ay natubo. Okay? So that tube is from the patient's lungs to the machine. Yung machine po, yung humihinga para sa pasyente. Okay? Yan po, you see the wires? Yun po yun leading to the ventilator. Okay? Next. Letter B tayo. Focus tayo kay letter B. Ayan po. Swero po yan. Ano? Marami po talagang swero na nakakabit po dun sa pasyente. Some of them are going to be on the arm. Some of them are direct po sa chest, ano? Into the great veins po of the body. So, yung mga swero po yan, actually maliit pa yung swerong yan, multiple or diretso na po sa dibdib, dyan po talaga dumadaan yung mga gamot po sa ICU. Majority of the medicines that we give in the ICU are what we call intravenous or sa ugat. So, bakit po sa ugat? Number one, people usually, they're asleep, no? So they cannot eat. Though may tubo ho, straight to the stomach. Sometimes po, pati yung gut natin or yung tiyan po natin cannot absorb medicines well dahil pati po sila nahihirapan, no? So we need to give it straight po into the veins, into the heart, and mabilis pong kumalat sa katawan. Unfortunately, eto pong swerong to, dyan po, marami rin pong infection na nangyayari because as I mentioned to you, madami po talagang bugs, pathogens, viruses, and bacteria that are living inside an ICU. Kahit linisin ho natin ng todo-todo, meron at meron po talaga. So that swero, first of all, yung letter A, dun ho yung pumapasok ang pneumonia. Letter B, I'm holding out my hand. Sa swero, ang dami rin pong infection sa swero. Okay? Letter C. Ayan. Sa mga na-COVID, alam nila ito, this is called the pulse oximeter. Naka-ano po yan, that gives your heart rate and your oxygen. So malaman po natin if you're getting enough oxygen from the ventilator. Marami pa pong iba, like the urinary catheter, hindi ko na ho pinicture. So, I'm going to show the next photo, which is the cardiac monitor. Paki-ano lang. Ayan. So our cardiac monitor po, no, the next picture is gonna come out. Our cardiac monitor po, usually, yan po talaga ang nahahanap din po sa mga ICU. And ang minomonitor po niya constantly is blood pressure. I think there's a second photo. Hindi ba na? Wait lang ah. Forward lang po natin yung second photo natin. Wait lang. Okay. So, later na lang po si picture ng cardiac monitor. Ina-upload pa po. Okay? Ayan, lumabas. Thank you so much. Okay. Do you see the number 60? Ano po yan? That is the, ano po, no? Usually, we monitor the heart rate. I hope it's 60. 90. Na ba? Sorry talaga.
Sige po, i-show ko po ulit yung second photo po.
Okay na? Okay. Just show what you can, okay? Heart rate, blood pressure, oxygenation po usually. Yan ang nakikita po sa cardiac monitor. At saka po yung line na tumatakbo, that's your EKG. So nakikita po yan on a cardiac monitor para nakikita po natin yung inyo po, yes, that one, this line po, yung pangalawa yan, EKG line po yan, nakikita po natin yung inyong cardiac rhythm. Ayan, 120/89 po yung BP ng tao. Okay? So yan lang po. These are some of the equipments that are located in an ICU. Okay? So thank you po. Good morning and let's answer questions. O baka bumati muna tayo.
Sige po, bati muna po.
Natakot ba kayo? Medyo scary, no? But again, remember the ICU is here to save your life. It can be very intimidating, pero talagang be guided po by your nurse and your doctor. Okay?
Okay po. From Miss Let Isidro. Good morning po, Doktora.
Hi, Let. How are you?
From Miss Rosana Lakap. Mabuhay ka, Congresswoman Dr. Ana York.
Hi, Ma'am Rosana. How are you? And thank you. Ang ganda ng bate.
Yes po. From Miss Leonora Matic Silva. Hello po, Doktora. Good day po.
Hi, Ma'am. Good day also.
From Mr. Donsky Vizcara Zarco. God bless po, Doktora, and happy morning po. Salamat po sa Diyos.
Ang ganda naman ng bate. Happy morning also.
From Miss Ides Marquez. Good morning po, Doktora.
Miss Ides, how are you?
From Miss Esguera Elena. Good morning po, Doktora.
Ma'am Elena, kumusta ka?
From Miss Remy Reyes. Good morning po, Doktora. A great day ahead watching here in QC.
Nasa QC pala si Ma'am. Hi.
Okay po. Question muna po tayo, Dok.
Okay. Sa mga gusto magpabate, may birthday or what, don't hesitate. Okay? Ayan.
Comment lang po kayo. Okay, from Mr. Remedios Nogoy Jeronimo. Takot po ako marinig ang ICU kasi po basta nadala doon, parang madalang po nabubuhay.
Naku, Ma'am. I have to be very honest with you. The ICU is not a happy place. It's only happy po once may nakalabas and we save somebody's life, lalo na kung batang-bata pa po. Masyado pong malungkot when somebody passes away. And ito lang how do we know pag napasok ka sa ICU kung ikaw ay mabubuhay o ikaw ay mamamatay? Okay? That is called prognosticating. Kasi para mag-usap kayo ng masinsinan ng doktor nyo kung dapat po ba talagang pumasok ng ICU o hindi. When someone goes into the ICU, usually they have what we call organ failure. May bumigay po. Okay? And when we say organ, either heart, na-atake, lungs, pinulmonya, natubo, brain, na-stroke, ganun po, no? So, it's not, parang may malaking problema po sa isang parte po ng katawan na talaga pong kailangan agapan. So, if you have one organ failure, sinasabi, my boss always loves to tell me this. If you have one organ failure, baka okay ka pa. Like, natubo ka, but okay pa naman yung blood pressure mo. Okay, that's good. Likely with the proper antibiotics and of course taking into account age and comorbidities, just kung ganda ng term, most likely you'll be okay. Okay? Number 2, kung dalawa na po ba yung bumigay po sa inyo, what is the meaning of this? For example po, napulmonya ka. Sabihin na natin na COVID. Okay. Aside from that, bumigay po yung kidney nyo na dialysis po kayo while in the ICU. That is 2 organ failure. The lungs and the kidney. So, mas lalong masaklap po yung sitwasyon na yun. Okay? And the third is if you have 3 organ failure, you have infection, bumaba po yung blood pressure nyo, requiring drugs to support your blood pressure, and let's say na dialysis ka rin. So, 3 na po yun. Nako, according to my boss, once you reach 3, and I think studies have shown this out, once you reach 3 or what we call multiple organ failure, yung chance nyo po talagang mabuhay ay bababa. And it should be communicated sa mga pasyente at sa pamilya kung ano po yung honest na sitwasyon pong nangyayari. Okay? So yes, it is a scary place, pero I would like to tell you it's also a miraculous place kasi why I went into ICU kasi parang ang makagawa ka talaga ng parang it's a feeling of saving someone's life, as in literal. So once you do that naman, ang ganda po ng pakiramdam. Pero once you enter an ICU, kailangan tapatan din ho ang usapan. So I wouldn't blame you, ma'am, for being scared. 99.9% of persons na pumunta sa ICU o nakapunta lang doon natatakot.
Okay, next question po. Sino ang doktor ang nasa ICU?
Magandang tanong yan, kasi wala namang, people, we know doctors as surgeons, anesthesia, diba, OB, pedia, wala namang ICU eh. Most of the doctors, though I am a specialist and there are specialists in ICU, most of the people po who do ICU in the US are specialists. Meron po talagang specialty na tinatawag pong ICU o critical care. Sa Pilipinas, it's not too developed yet. But usually, once you get into the ICU, kung natubo ka, they will require the assistance of a pulmonologist. And usually, sila na rin po ang nagmamanage kung bumababa po yung blood pressure nyo or you have a problem with your heart, they may call in a cardiologist. So, my answer to this is, in the US, they have surgical and medical ICU specialists. In the Philippines, meron na rin po. But usually, aside from that, usually cardiologist po and pulmonologist. Okay? And of course, depende po kung nangyari. Kung na-opera kayo, surgeon, meron. I would like to say also, in the US, anesthesia and ICU often go together. Or pulmonary and ICU, or cardio and ICU, usually may cross a specialization po ang mga tao. Can a regular doctor admit sa ICU? Yes, you can. Kasi like for example, regular doctor, regular internist, okay naman pong mag-admit sa ICU. Pero kung marami na hong problema, my advice would be to ask for help and to form a good team.
Okay, next question po from another viewer question. Bakit ang daming tubo at wire? Nakaka-nervyos. Parang lahat doon ay namamatay.
Yan na nga ako. Parang ano, medyo related rin ito kay sa question ni Ma'am Remedios, no? I mentioned na rin nga na if one organ system, medyo okay pa. Two organ systems, mahirap. And three is really bad news. Okay? Again, ano, it depends rin on the age and kung ano po yung lakas po ng tao before they went into the ICU. In general, ha, younger people do better. And number two is comorbidities. Ano ba yung comorbidities mo? Kung diabetic ka, nakadialysis, mahina puso, lahat na ho yun, then na pulmonya na. Alam mo, this is also very much related to COVID eh. Kasi the more comorbidities you have, and then may infection, wag na natin sabihin COVID, sabihin na lang natin pulmonya, the regular pulmonya, may edad, lumalabas, parang COVID, ano, may edad, elderly age, many comorbidities, these kinds of people usually do not do well in the ICU. Kasi ang dami na ho nilang kaakibat na sakit, then bigyan nyo ho ng pulmonya or something or atake sa puso or what, sinagasaan. Pag nagsama ho lahat yan sa ICU, it is a very difficult situation. So yes, marami po talagang mamamatay, lalo na kung marami silang comorbidities, and number two, marami pong bumigay na organ system po sa kanilang katawan. As I mentioned to you, ang daming wire po, medyo diniscuss na natin earlier, kasi talagang ang dami pong equipment na nakakabit po sa tao. It can be extremely scary. Kung yung daddy mo yon, yung mommy mo, yung lola mo, yung lolo mo, yung asawa mo, parang hindi mo na maakap yung tao dahil nagbi-beep, all the equipment is beeping. It can be ano. That's why I also mentioned sad and scary. Kung ikaw yung pasyente, tapos parang ang dami mong nakakabit na wire, nakakatakot po talaga. But again, honest talking is really the best. Kung nalalaman mo naman na nakakabit ka to all those equipments to save your life, and maganda naman ho yung naging outcome, then pwede naman ho magpalakas ng loob.
Next question. Ano ang kinaiba ng ICU sa critical care?
More or less po, we use that term interchangeably. Some people say intensive care unit, some people say critical care unit. So pwede naman po. Ako po, I am an ICU specialist and I'm also a critical care specialist. So halos pareho na rin po yun. Parang may mga comments ako from guests. Can you read that?
Yes po.
O sige, ito na lang muna and then look for comments pa.
O sige
Parang
po.
kasi may
Okay, ito muna po. Kailangan bang ICU lahat ng serious cases?
Magandang tanong yan. That is a very good question. And hirap ah. What I would say po is, before you put someone in an ICU, and before you go down that path, na patubo mo yung nanay mo, pakabit mo sa lahat, pa-dialysis mo lahat yon. Before you do that, you need to talk to your doctor first. Okay? Kailangan malinaw po sa inyo yung nangyari, malinaw po sa inyo yung kondisyon ng pasyente, and number three, malinaw din po sa pamilya kung ano po ang expectation po nila. Okay? And kailangan po tapatan both sides, from the doctor, the patient, and the family. Kasi po, everyone's situation will be different. And everyone has a different decision po na pupuntahan. Wala pong maling decision po whether a person should be in the ICU or whether a person should not be in the ICU. Okay? What is important is na pag-usapan nyo po yung decision nyo and you are tanggap nyo po whatever the consequences would be. Ito lang, i-share ko sa inyo. When I was starting out, I had a patient, she was 17 or 18 years old. She had lupus. Nakadialysis na po yung tao, her kidneys were failing. Okay? I was very young. Dalawa kami. I think I was only 30 or something, ano? And may kasama po akong kidney specialist. She knows who she is. She's now in the US, one of the best kidney transplant specialists po ngayon. Pareho pa po kami, dalawa kaming bata noon, we were running around St. Luke's. Sinabi po talaga sa akin nung pamilya, I encountered the patient in the ICU. Sinabi po sa akin nung pamilya, Doktora, please tell us the truth about our daughter. Naka 1 week na po kami sa ICU and let's be honest, matindi po yung gastos. Ngayon, if you tell me na may chance po yung anak ko, isasanla ko po yung bahay namin. So, Doktora, please tell me, isasanla ko ba yung bahay ko o hindi? Oh my God, para akong napaupo po ako because based on the honest assessment of the situation po talaga, isasanla ng tao yung bahay niya. Parang napaupo talaga ako. In fact, I cried. Okay? But talagang bata pa po yung pasyente. I felt like there was a good chance. We were doing all that we could. Sabi ko, sige ma'am, go. Laban natin to. But I know the responsibility that I'm carrying bilang doktor. I know the responsibility that I gave to the patient and to the family. And by the grace of the Lord, nabuhay po yung pasyente. That's what I mean. Not all of the outcomes will be good, ha? But the important thing is, you talk to each other. Mali ba yung wag i-ICU ang isang pasyente? Wala pong mali doon. Kasi kung wala naman maitutulong, for example, stage 4 na po yung tao or 99 years old, wala naman pong mali eh. Or for example, nakaratay na po na 5 taon. It all depends on your family values, what you expect, and what you talk about with your doctor. Okay? Wala pong mali if you choose not to ICU your relative or yourself. Kung tanggap niyo po yung situation, it's fine with you. You feel like you've done your best. Ayaw niyo na pong mag-torture ng tao. And I'm telling you, kung hindi po makakatulong yung ICU sa isang tao, you are actually torturing that patient. And ako po, mabigat sa loob ko yun. That's not why I entered medicine. The most important thing is being open and honest with the doctor and the family. So, ang hirap ng sagot. I don't know. I hope I was honest. Oo.
Okay. A question from Mr. Fer Clarin. Ang ibig sabihin po ba, Doktora, pag tinubo ka, hindi ka na makakasurvive, diba? 70-30 chances?
No, hindi po ganon. That's not correct. Ito lang ano ko sa'yo. And why it's not correct. Depende po kung bakit po kayo tinubo. Okay, Sir Fer. So, no, don't think of intubation and going to the ICU as a bad thing. It can be a good thing because we will save your life. Okay, ito yung kwento. I have a kwento for you. I was in the US. I was in New York. Social, ano? 70 plus yung pasyente. Ngayon, she has a heart condition po. Parang for some reason po, nagkapulmonya, ganon. She wasn't able to take her medicine. So she went into acute heart failure. Ngayon, the patient had a do not resuscitate order. In other words, wag na hong itubo, ganon. Which is okay, as I mentioned to you. Pero nag-usap po kami ng pamilya. My boss felt that her situation could be reversed. Okay? May lunas pa. So sabi niya talaga, kahit ho nakalagay na do not resuscitate, or wag na pong, pabayaan na lang po, no? Or do not, wag itubo, talagang kinausap po niya yung pamilya, sabi niya, I feel like I can save this lady's life, okay? Now, just give me 48 hours, kung hindi talaga kaya, honest naman, I will tell you. Alam mo, within 48 hours, we saved the patient. She was sitting up, kasi po we gave her the proper medicine, na labas po niya lahat ng excess fluid, nakahinga po, and within 48 hours, binunot yung tubo, and she was alive and well. She went to the ward after that. So, what I'm trying to say, sir, yes, kailangan talaga suriin yung bawat kaso. At sa pagsusuri po, kailangan po tapatin ang bawat pamilya. Kung talagang wala na, wala na. Kung talagang meron pa, sabihin naman. Okay? Like my boss, he was a cardiologist. I cannot forget that. Binaliktad niya talaga yung pamilya. Sabi niya, give me time. Feeling ko kaya ko pa talaga. And it happened. So kung natubo ka,
From Miss Leia.
wait lang. Kung natubo ka, It is serious, but there are cases of intubation na nare-reverse po and we can save somebody's life. And that's why I took up ICU. So may hope pa po,
Okay na
may
po.
hope pa.
Yeah. Okay, from Miss Leia Isais Cristobal. Doktora, ako na CCU, then ICU. Thanks po lahat na lampasan ko, pero true hindi po talaga biro.
Ayan, talaga ma'am. Mabigat. Mabigat po. And by the grace of the Lord, some people survive. And that's why I entered medicine, for that survival. Ayan. Kasi para talagang nakatulong ka talaga eh.
Another question from a viewer. Doktora, bakit ayaw kaming tapatin ng mga doktor tungkol sa kalagayan ng pasyente? Nangyari po ito nung na-ICU namin. Namatay po siya last year of stage 4 lung cancer.
Siguro relative nila, no? Who died of stage
Yeah,
4 lung
opo.
cancer in an ICU. Ito lang talking about what will happen in the ICU. O tapatin na natin, talking about passing away, talking about dying, yung namamatay, ang hirap po sa Pilipino yun. Sometimes meron po talagang nasasaktan, nagagalit. Bakit mo sasabihin mamamatay ang nanay ko? Bakit hindi kung mamamatay talaga yung nanay mo? I have to tell you, okay? Pero marami po talagang mga tao na sensitibo po doon. But a lot of, I was trained in the US, tapatan lang po talaga dun eh. Baka mademanda ka pa pag hindi mo sabihin. So, it's our culture kasi. It's hard for us to talk about this. But we need to. But we need to. Kasi, kawawa rin ho yung mga pasyenteng dapat na mayapa na po. At actually, meron na ho talagang pagod na at gusto na pong mamayapa. We have to respect their wishes. Hindi po wishes ng mga family, hindi po away ng pamilya. The number one consideration po is the patient. Pero talagang based on our culture, and I think a lot of older doctors will agree with this, ang hirap pong maging open. But kung kayo po ang pamilya, seek the truth. Kung kayo po ang doktor, be open but be sensitive. Yun po.
Okay, next question po. Doktora, may taning na ba agad ang nasa ICU?
Meron. Pero, it again depends. Ang hirap eh, di ba? What's the meaning of may tanning? Is there, ako, the way I see it sa may tanning is there a possibility of death? Yes, there is. There really is. But we have to be, kung minsan kasi may nagtatanong, may nagtanong sa akin dati, Doktora, 50-50 na ho ba si nanay? Sabi ko, hindi po 50-50. 70-30. Katulad ho nung tinanong ni, I think maybe Mr. Fur, sabi ko 70-30. Sabi lang, ay my God, 70 pa pala mabubuhay si nanay. Very good. Sabi ko, hindi ho, 70% mamamatay, 30% mabubuhay. Nag-iyakan po. But, yun po yun eh. May taning ho talaga, but we promise to do the best we can. And when we reach the point na we cannot do anything anymore, we will tell you. Wait lang po, parang may mga pumapasok pa dito.
Sige po. Sige lang po, Dok.
Okay, sorry. Yes.
Mga bayi
Okay,
po.
go.
Okay. Doktora, anong gagawin namin kung ayaw ng pasyente pa ICU? Natatakot daw sila.
Merong ganun. That also includes those who don't want to go to the hospital. Sana, I mean, kung takot po yun, we have to move past that and explain that what's going to happen. Pero there are patients who don't want to go to the ICU for very legitimate reasons. Yung nanay ko po was one of them. And we did not ICU my mom. Tanggap po namin yung nangyari. It was a long process. It was a painful process. But eventually, ganun po talaga ang buhay. But choice niya yun, ha? So, wala pong masama if someone would choose not to go to the ICU with full knowledge po. Yun ang importante, with full knowledge. And tayo, what should you do? Kung ganun po yung situation, you have to accept it kahit na ganun, gaano kasakit. Because you are not the patient. Mahirap ano? So, anything else? That's it for today?
May dalawa pa po.
Sige, go.
Tapusin lang po natin yung dalawa, then bati po tayo ng konti.
Okay. Ay, bumati muna tayo ng
Okay.
konti. Masyado na
Doktor.
mabigat ang usapan eh.
Sige po.
Parang ako nalungkot na tuloy eh.
Sige po.
Maybe 2 batis lang para we can smile naman.
Eto.
Hi, Elena. How are you? And good morning.
Wait lang.
And from Carla Marie, kaibigan ko yan. Carla Marie, how are you? And good morning. So sige, let's go na to the questions. Sorry, naglalag ko minsan ang ating internet, guys. Sometimes talagang ganon.
Okay, I'm back
sige.
na, I guess.
I think that's okay.
From Miss
Ayan, okay.
Sige po.
Binati na natin si Carla. Carla, kumusta ka? Mama mo and daddy mo, how are they?
From Mr. Hertrudes Magtalas. Good morning po, Doktora.
Ma'am Hertrudes, how are you? From Erna,
From Miss
good morning.
Erna Lorca.
Sige.
Good morning. From Mr. Pablo Dueñas, good morning po, Doktora.
Hi, sir. Kumusta?
From El Ignacio Lacap. Have a good time, Doktora.
Thank you, sir. So sige, let's do our last question.
Okay po. Yung last question po natin galing po sa kanya. From Mr. Ignacio Lacap. Doktora, bakit may linalagay na bakal sa lalamunan? Parang iyong stand ng sapatos, pero 3 beses akong nasaksihan sila ay namatay. Linagay sila sa ICU.
What you're talking po is the intubation process. We need to lift the jaw, okay? Metal po talaga yung ano doon, and it's called a laryngoscope, no? Ano po yan talaga, that we use that for ano po, for intubation. Ano po? Medyo wait, I'm trying to find the picture eh. Wait lang ah. Yes, it's called, wala akong mahanap na picture at ayoko nang pakita kasi baka matakot po yung mga tao. Yes, it is called a laryngoscope. It's to lift po your jaw para mailagay po namin yung tubo. I know that procedure and I do that procedure frequently. It's kind of scary but I promise you tulog po kayo, okay? It's not gonna happen. Why do people do associate intubation, ventilator, na tubo with dying? Because let's face it, a large part of the ICU persons die. Pero kung minsan nababalitaan lang po natin yung mga namatay, marami pong nabuhay. And as somebody mentioned to us, the ICU and the CCU saved her life, but it was very difficult. So yun lang po. The ICU is not particular. Sometimes we hear the bad parts, pero may good parts din po. And to save someone's life and to give them another chance po is a beautiful thing. So yun lang po. ICU is scary, but again, if you work with your doctor and your family, and you make known po kung anong gusto niyo mangyari sa inyong sakit, malalampasan po natin yan together. Okay? Salamat po and magandang hapon.